During my master's in public health, I became really interested in learning about healthcare disparities in overall health as well as mental health. And so I sought out opportunities to kind of learn more about that. So I became part of a research study that was designing an intervention to treat postpartum depression in Haitian immigrants. And this experience really just highlighted to me how important it is to be culturally sensitive and culturally aware when designing treatment options for patients. It was really at that time that I first became interested in psychiatry, and also I realized that global health and cultural issues had to be part of my training and education. So my goal really is to raise awareness about global mental health issues and really make it the norm to talk about cultural issues with patients. One way to do this is working on how to develop a cultural formulation, and I really think that should be part of every patient we see, because every patient has a different culture that they're coming from and they're experiencing. And secondly, just raising that awareness so that people are curious about it and asking questions about it to really help them make the best treatment recommendations for their patients. Teaching and education has always been a part of my life. I've always sought out opportunities and to work with organizations that really value education. So during my intern year here, we got to work with medical students, and I loved the experience, and I loved being part of their first exposure to psychiatry. So when I really thought about what type of career I want after residency, I knew that education had to be a part of it. And so the Clinical Educator Track here is just that perfect fit for me. It's allowed me to think about a project, allowed me to learn about curriculum development, work with mentors in the community, and really grow as not just a psychiatrist, but as an educator. My project is focused on creating a curriculum or a pathway for residents that are interested in global mental health issues. I myself have been interested in global health issues for a really long time, and I found that a lot of my co-residents were too. However, we didn't quite know how to develop that interest more. So my project really has a lot of parts to it, but its main focus is first creating education and awareness about global health challenges, whether that's through seminars, discussions amongst residents. We're talking amongst each other about just different cases. And then secondly, creating opportunities for interested residents to work in the community with people that are already doing great work in diverse populations. So I have a lot of interests in psychiatry, and I think that's what really drew me to this field. So when I think about life after residency, I'm not quite sure what I want to focus on yet. But I think that's really the beauty of this field, that I have that flexibility to shape my career the way I want it to be. I definitely see myself still working in academia and education, definitely global mental health issues, and also working in an integrated care environment. I think that is really important for the practice of psychiatry.